If you are 28 weeks pregnant, congratulations, because you are now officially in your third trimester. You are in your 7th month, and you only have about 12 weeks left to go. This is where things start to get really exciting, because your baby is going to be here soon. There is so much happening with your baby and with your body right now, and it's such an exciting time. So we're going to talk about all of that. But first, if you are new here, you are watching the Health and Medical Zone. And if you're new here in the Health and Medical Zone, it means in good health and spirits. So if you like being healthy and happy, click subscribe, because you are in the right place. So at 28 weeks, your baby weighs about 2 to 2.5 pounds, and they are around 15 inches long. A few weeks ago, your baby's eyelids became unsealed, and now they can open and close their eyes. They even have a full set of eyelashes that they can blink with. They can also make cute little faces and stick out their tongue while they sleep. Your baby has now entered what's called REM sleep, which stands for rapid eye movement. This means they are probably dreaming when they sleep. They are also developing sleep-wake patterns, and if you pay close attention, you may notice times when your baby is very still and other times when they are moving like crazy. That's because they are either asleep or awake. Up until now, you've probably been enjoying feeling your baby move, but those movements may have felt a bit unpredictable. Now that you are in your third trimester, you can actually use your baby's movements as reassurance that they are doing well, and we do this with something called kick counting. Kick counting is when you pay attention to how long it takes for your baby to kick, punch, or roll 10 times. Hiccups do not count. What's important to remember is that your baby isn't going to pass the kick count at every moment of the day. As we talked about earlier, they have sleep-wake cycles, and when they're asleep, they're not going to be moving very much. So don't panic if you try to do kick counting and your baby isn't moving a lot right away. They may just be sleeping or, kind of chilling in there. You want to focus on doing kick counts during times when you know your baby is usually more active. Babies tend to be more active after meals, in the evenings, or after you've had something really sugary to eat or drink. Those are great times to do kick counting. Sometimes it may take just a couple of minutes to feel 10 movements, and other times it may take longer. But if you don't feel your baby move 10 times within 2 hours, and you know it's a time when they are usually very active, then what I want you to do is drink a glass of juice, lie down, and really focus on paying attention to their movements. And if your baby still doesn't pass the kick count, then go ahead and call your OB. And really, anytime you feel unsure, notice decreased movement, or you're just concerned, you should call your OB. That's exactly what they are there for. Let them know what's going on, and they may have you come in to get checked. And even if you do end up going into the office, most of the time, everything turns out to be just fine. Now, if you were to go into labor today, your baby's lungs are much more developed, and the chances of survival are significantly higher. That said, your baby would still have a long road ahead and would most likely need time in the NICU. Because of that, if you were to go into labor at this point, your OB would do everything they could to keep the baby inside for as long as possible. By now, you should have had your glucose tolerance test. If you haven't, make sure to talk to your OB about it. I talked a lot about this in my week 26 and week 27 videos, so be sure to check those out if you haven't watched them yet. At 28 weeks, you may also need something called a RhoGAM shot if your blood type is Rh negative. Rh is a protein found on the surface of red blood cells, and about 85% of people have this protein. If your red blood cells have this protein, then you are Rh positive. If they don't, then you are Rh negative. This isn't a problem when we're just talking about you. But if your baby has the Rh protein and you don't, your body can recognize that difference and start making antibodies. With a future pregnancy, if your next baby also has the Rh protein, those antibodies could attack the baby's blood cells. The RhoGAM shot prevents this from happening. Early in pregnancy, your OB or midwife likely checked your blood type through lab work, including whether you are Rh positive or Rh negative. If you are Rh negative, you will most likely need the RhoGAM shot, and it's usually given right around 28 weeks. Another change around this time is that many offices will start having you come in every 2 weeks instead of every 4 weeks. So expect to see your OB or midwife a little more often from here on out. You might also start noticing that your breasts feel fuller, and you may even notice some nipple discharge. Some women experience this and some don't, so don't worry either way. If you do notice it, it will look like a thick, clear yellow fluid called colostrum. This is the first milk and what your baby will drink when they are born. Colostrum contains antibodies, water, protein, and minerals that your baby needs during the first few days of life. After a couple of days, your body will stop producing colostrum and begin producing breast milk. So after you give birth, you may hear your nurse or lactation specialist talking about your milk coming in, and that's exactly what they're referring to. We'll talk more about this as you get closer to delivery. Speaking of delivery, now is a good time to start thinking about which hospital you want to deliver at. If you have insurance, you should call them at this point to find out which local hospitals are covered. It's also helpful to ask about your benefits so you can be financially prepared for when the big day arrives. Many hospitals offer a discount if you pay your portion of the bill before you go home after delivering your baby. If they do, it's usually a percentage off, and it can definitely save you some money if you're able to take advantage of that. You'll also want to ask your insurance about co-pays, deductibles, and what percentage they will cover once your deductible is met. Keep in mind that you'll likely receive bills from multiple providers, including your OB, the hospital, and, depending on your delivery, possibly an anesthesiologist. Your baby's pediatrician and even an audiologist who checks your baby's hearing may also bill separately. Being aware of this ahead of time can help you feel more prepared and less overwhelmed a few weeks after the baby is born, when those bills start arriving. If you're experiencing Braxton Hicks contractions, I talked a lot about that back in week 25. If you're dealing with leg swelling, check out week 24. And if you're having a lot of back pain or round ligament pain, be sure to watch week 18. And if you're new to my channel, make sure to subscribe and hit the notification bell so you don't miss future videos. And if you know someone else who's pregnant, go ahead and share this video with them so they can get this information too. Thank you so much for watching.